My name is Gabriel Poston, and I am in the Nursing 448 class for Dr. Kirshner. The healthcare policy which interested me and I am for is legalization of marijuana. As of today, there are currently 28 out of 50 states who have marijuana legalized for medicinal usage. Out of these 28 states, 9 of them have legalized marijuana for recreational use for adults 21 years of age and older, with Washington and Colorado being the first 2 states to legalize marijuana for recreational use. Legalizing marijuana for just medicinal purposes would make a huge impact on reducing harm to the public, help those in medicinal reasons, would create more jobs, and of course would create a tax revenue. Medicinal marijuana could reduce harm to the public because that would then be less people out in the streets looking for and selling marijuana. Also, according to www.drugpolicy.org, quote unquote, the criminalization of marijuana use disproportionately harms young people and people of color, sponsors massive levels of violence and corruption, and fails to curb youth excess. Those who need marijuana for medical reasons may be diagnosed with glaucoma, ADHD, depression, social anxiety, cerebral palsy, and autism could possibly be more interested in using cannabis to alleviate their symptoms versus prescription pills that could result in horrific side effects that do more harm than good. For example, I stumbled across a video of a young girl named Kara that suffers from cerebral palsy and autism that results in self-abuse of her constantly hitting the right side of her face uncontrollably, which is something that she deals with on an everyday basis. The prescriptions that were prescribed to her were either slow or did nothing at all. The video that I watched shows Kara going through a cannabis vapor treatment in hopes to alleviate her symptoms, which almost instantaneously helps Kara to calm down and stop the self-abusing. Legalization of marijuana would also spawn thousands of jobs for citizens of the United States, as well as bring in tremendous amounts of money from taxing the sales of marijuana. For example, in just 1 year of legalizing marijuana for recreational use in Colorado, there were close to 10,000 jobs created for people of Colorado, which was only 0.04% of Colorado's workforce. Also, $98 million was brought into Colorado for again having marijuana legalized in just 1 year. $2.5 million was set aside to increase the number of health professionals in Colorado public schools. Though some fear that legalization of cannabis will have a negative effect on their state or community, for a reference we will look at Colorado's 1 year status after legalizing marijuana. In the first 11 months of 2014, Denver saw a decrease in violent crime rates. According to www.drugpolicy.org, quote unquote, upwards of $8 million has been allocated to fund youth education and drug prevention efforts. Colorado also saw growth in the economy as well as the lowest unemployment rates in years. Legalizing marijuana for at least medicinal purposes could make a huge impact on our country's health, tax revenue, crime rate, and unemployment rate, which is again why I am in favor for legalization of marijuana policy.